Hi everyone, I'm Gopal Shettigar. I own and run a fitness center, Figure It Out at Andheri, Mumbai, and my single goal is to promote fitness across populace, across all age groups.
Hi everyone, I'm Dr. Charmie Desai. I'm a physiotherapist. I own and run a clinic called Your Physio in Bombay.
As a fitness enthusiast and a fitness champion or a protagonist, as you would like to call, one of the common fitness conditions that I've observed amongst people, especially in the age group of 40 and above, is frozen shoulder. And the worrying factor is the number of people with this condition seems to be increasing, and many of them with persistent symptoms. Awareness in this area also is either very limited or very scattered, which means there is either an overlooking of the condition or following a very incorrect line of treatment.
Yes, so Gopal, yes, I agree with your observation here. I agree that the incidence of frozen shoulder is exceptionally high, and not just that, the incidence of myths around the frozen shoulder is even higher. So, if I just have to start with it, that the name itself, right? So, we've been saying frozen shoulder. Frozen shoulder in itself is partially a misnomer. So, this is why I was so interested in having this discussion about frozen shoulder because there is a lot to understand about what truly constitutes a true frozen shoulder.
Yeah, in fact, true. I mean, I was always wondering why do we call it frozen shoulder, and but then we got so used to using this term, so I think we got along with that. Like now, from my perspective, looking at it, say both from a non-clinical perspective and an empirical perspective, my understanding of frozen shoulder. Of course, you can always add a lot into that. Definitely, Dr. Chami. One is it's a condition where the range of motion, ROM as it is called, of the shoulder is limited, leading to difficulty in performing normal activities like taking a book off an overhead shelf, or combing your hair, or even putting on your shirt. Secondly, I think there is a partial immobilization of the shoulder and possible inflammation of the shoulder joint. Then there is always that dull ache in the shoulder, typically when waking up from the bed, which sometimes could become very much traumatic during the day.
Yes, I think you've encapsulated the entire symptoms of frozen shoulder extremely well. So, if we had to understand the frozen shoulder from an anatomical perspective, we should first understand what the doctors around the globe call frozen shoulder. Okay, so we call it adhesive capsulitis. Now, let's try and understand this word. When we say adhesive, naturally it means something that's sticky. Capsule is nothing but a pouch or a polythene bag which wraps your shoulder joint. And itis means inflammation. So this is frozen shoulder or adhesive capsulitis is nothing but sticky inflammation of the polythene bag that surrounds your shoulder joint. So when I come to the misnomer, that is why did I say initially that frozen shoulder is a partial misnomer? It's because frozen shoulder in our clinical experience is used as a loose diagnosis or any shoulder which is A, painful, and B, has a restricted range of motion is often labeled as frozen. But as we know, in the shoulder joint, we have a lot of structures. So we have muscles, bones, ligaments, capsule, we have the labrum. So damage to any of these structures can lead to the so-called frozen shoulder. The true frozen shoulder is when the capsule is involved. So this is a discussion that's important for every patient to have with their doctor or their physiotherapist, that which is the structure that is truly involved rather than a loose nomenclature like frozen shoulder, right?
Indeed, I think that was very revealing, and I think kind of like clears some of the misconceptions which we generally carry with us. Okay. Now, let's go back and like let me understand from my perspective again. I would say a very generic perspective. The cause of what we, I mean, I'm using this term frozen shoulder again, but the cause of that, like One, I think it's due to the associated or collateral damage due to limiting movements of the shoulder after an injury or fracture-like condition in where you end up wearing a sling for a very long time, or it could be sometimes an enforced immobility due to stroke, heart condition, or surgery, or similar conditions where like there is an immobility which becomes a part of your kind of recovering from that. And maybe, I mean, the fitness enthusiast always wakes up in me and says that maybe an underutilization or lack of exercises to strengthen the shoulders also could sometimes, like be a kind of a catalyst for this. Now, Dr. Desai, how would you kind of explain this clinically and bring in more clarity to our common understanding?
Right. So, yes, I agree with what you've said. And it's very important to understand this. What causes the frozen shoulder, right? So, adhesive capsulitis or frozen shoulder is primarily an inflammatory condition, like we just established. So, any inflammatory condition has to be triggered by something in the body. So, something, that thing, what triggers this inflammation to happen, it could be a hormonal imbalance, it could be previous injury. It could be some sort of a systemic inflammation as it's there in diabetics and thyroid patients with thyroidal abnormalities. Anything that's triggering the inflammatory or swelling process of your capsule, which in effect leads to thickening of your capsule, is going to be a causative factor for frozen shoulder. Yes, now there's new research which is also saying that patients, especially the ones who are not doing enough flexibility exercises, that is stretching and some specific and generalized stretching, uh, they are at a higher risk of getting frozen shoulders in the future. So this is something that's important for us to understand. Also, we have a lot of patients who have this often this sort of a thing presentation wherein there is no previous trauma, there is no injury, there is no diabetes, no hormonal disorders. So I want to extend this line over here that a large proportion of frozen shoulders are idiopathic. Idiopathic means there is no apparent cause of this frozen shoulder. So we should be prepared with this knowledge in our head that it need not always be associated with a condition. It might be a condition which has no cause at all.
Well, idiopathic is something which it happens and it's something which is beyond your control, as I understand. But I would definitely think, like when I hear you, there are a few factors that puts a person at a higher risk for developing frozen shoulder, right? Yeah. Like diabetic patients, for example, are prone to developing frozen shoulder, but they will also take longer time to heal and restore the range of motion, right? Absolutely. And even other comorbidity conditions like say hypothyroidism, hyperthyroidism, Parkinson's disease, and maybe cardiac conditions. All these things I would actually understand as something which would kind of further aggravate and like put people at more risk. Now, what's the correlation of all these maladies, as I would put it, with respect to frozen shoulder condition?
Right, 100%. So there is a strong association between frozen shoulders and let's say diabetes, for instance, right? Same is true for other hormonal imbalances. So I'm going to try and break down the mechanism for our listeners, okay? So in diabetes, there is a general state of hyperglycemia. That is, there is a high amount of sugar that is running through the blood. Now, this high sugar, it leads to a type of increased collagen deposition in joint capsules. Now, I'll simplify this. Collagen is this tough kind of a tissue, all right? And normally also, in a normal human being who doesn't have hyperglycemia also, there is a regular collagen deposition which is happening in your capsule. It's a part of your daily wear and tear process. But in hyperglycemic stages, there is an extensive deposition or increased collagen deposition. And collagen being a very tense tissue, or it it reduces the flexibility of the joint capsule. And once the capsule's flexibility is reduced, the range of motion will naturally be reduced. Just to give you an example of what we are saying, in a normal shoulder joint, if you had to inject normal saline inside the capsule, right? So you could inject about 20 ml of normal saline in a normal joint. But in a frozen shoulder where the capsule has become adhesive, you cannot inject more than 5 ml. So you understand here that the joint space in itself has become so compact that it's naturally not going to allow any range of motion to come in. So this is how they are associated.
Hmm. I think basically anything in extreme is not good, right? That's what it
Yes.
is. So then why just we are talking about frozen shoulder? Why not say a frozen knee or a frozen hip or any other joints as such?
Yeah, that's a really good point, Gopal, because this is a question we often face in our clinics as well. So one of the thing is that the shoulder joint anatomically has a certain blood flow distribution, the microvascular circulatory system, that is the network of blood vessels that is depositing blood in a joint, are one of the poorest in the shoulder joint. Okay, and scientists are suggesting that it is because of this poor vascular structure that surrounds the shoulder joint that of all the joints, the shoulder falls victim the most. So what I'm trying to say here is this increased collagen deposition is happening everywhere in all the joints. But because of the poor vascularity of the shoulder joint, that is where the symptom becomes apparent.
Hmm. So shouldering more responsibility is always risky.
Well, it's the most mobile joint of your body. It does a lot of work. So,
Yes,
yeah,
of
we have
course.
to do a lot of work on it as well.
Yes, of course. Okay, now also what I understand is that this condition develops in kind of distinct three sequential stages as freezing, frozen, and thawing. Okay, what exactly are these stages, and is there a span of like time for each of these stages, and how do kind of patients react during each of these stages? Is there a difference in which the patients kind of show their trauma across these various stages?
Yes. So there are three stages to frozen shoulder, but in clinical practice, in our offices, we see that there is a good overlap between these three phases. In theory, yes. In research, perhaps, but when the patient is reporting to us, there is usually an overlap between the freezing, frozen, and thawing phases. So, typically, when a patient, if they report early, they report during the first acute phase, wherein the pain is the primary complaint of the patient. Slowly, the pain starts to reduce and the joint starts to become more and more stiff. In some chronic cases of frozen shoulder, their patient actually has no pain at all, but very, very limited range of motion. And sudden movements will often give pain to this patient, but otherwise, at rest, the patient may not have any pain at all. Patients often complain about their day-to-day activities like wearing clothes, pulling a seat belt out from a car, and so this is how the presentation of patients goes. How long does it last? Well, it varies from patient to patient, but patients can get better from 4 weeks to 12 weeks window period from the start of their therapy. So I'm talking about the day when you come to therapy. It may take about 1 month, it may take about 3 months to get better slowly. This is an important thing that I wanted to discuss as well. The reason why I am straying, if you can see, from using the terms freezing, frozen, and thawing. A few of us stay away from this terminology because of how immediately imaginative this terminology is. See, the last thing I want as a clinician is a picture of an iced shoulder in my patient's head, because both it's inaccurate, as I have explained before, and also because of the negative subconscious feeding that truly impacts the recovery process. Now, this is something that all clinicians, everyone in the health and fitness industry needs to keep in mind, that we are positively guiding our patients regarding their limitations at this point, rather than putting imaginative terms like when we say to anybody, this shoulder is frozen, they will naturally have uh, sort of an inhibition from moving the shoulder.
So, I mean, this is something which is a common experience of most of us, like what at least I would like to, God forbid, I get into any such condition. I would want my clinician to not, kind of overwhelm me with so many terms. Tell me, yes, there's a problem and make me understand, of course, the problem. And then let's say, get on with how to kind of get over it. Right, so that's something which will bring in a lot of confidence rather than like getting overwhelmed with too many terms and like which kind of puts the mind in a state of confusion, and then like you tend to stress up more on that.
Yes, 100%. I think doctors understand this, realize these days, but we also have Google doctors. So, we have to be careful of that one.
That number is increasing day by day, especially these days.
True.
Okay, now this was very interesting. Now, having understood the entire diagnosis and the cause of, I will say, this condition, let me try to refrain using this term more. What would be the line of treatment as per you, both, I would say, surgical as well as non-surgical?
Yeah, so this is the best part. Okay, so treatment and recovery is both very well possible, and this is one of those conditions where physiotherapy has fantastic results. So this is not just in pain relief and improving range of motion, and also it also helps prevent recurrences. If you come to physiotherapy, what do we do in physiotherapy? A good physiotherapy session is always three things put together for any condition. Okay, this is general. One, we need to use some equipment, or probably the doctor is using some method to reduce your pain, help in pain management. Second, they are using manual therapy where the doctor's hands are on the patient's body, trying to improve range of motion, maintain range of motion, stretch scar tissue, so on and so forth. And third is proper exercise guidance, right? So this is the part of physiotherapy that comes in. Patient may simultaneously be put on some NSAIDs, that is non-steroidal anti-inflammatory drugs that help in pain management as well. In some rare situations, we can even go for a corticosteroid injections. Those options are also there. And yeah, so these are your typical non-surgical treatment options. Typically, you should give a window period of 3 months to 6 months to this non-surgical intervention. If it fails, then only we should resort to, this is the common guideline, then we resort to an interventional treatment, that is surgical treatment. In surgical treatment, we have various options. So the first one is mobilization under general anesthesia. So all the doctor would do is probably give you general anesthesia, then take your shoulder, move it around, open up all the scar tissue, and I'm just simplifying the surgery too much. But yeah, this is the primary procedure. And then there are some other surgical procedures like keyhole surgeries, arthroscopic surgery, to exactly address the underlying problem. Before that, they would usually tell the patients to get an MRI, and the MRI would show you exactly which part of the capsule is involved or which muscle is involved, and then we do a keyhole surgery and get to repairing that particular part, which also has very good results. After such keyhole surgeries, it's extremely important. How do you take your rehabilitation forward? You have to work hard in rehabilitation again. It would take about 6 weeks to 8 weeks for you to start complete physical activity, which is involving the upper body, like throwing, tennis, so on and so forth. And then, so that's the entire spectrum of treatment.
Hmm? That indeed was very interesting. Now, I mean, throw some more light into this. I think I always feel that prevention is better than cure, and it's an old adage also. And
Yeah.
the fitness enthusiast in me would always say that despite all the causes and probable inevitability of an idiopathic conditions and other things, certain fitness practices and lifestyle adjustments are very necessary, not just to prevent recurrence of the condition, but maybe even prevent it right up front. Right? For
Yeah.
instance, I think exercising the shoulders, of course, all the body parts, but as you said, the shoulders are the ones which are most often used very regularly,
Yeah.
mimicking the normal activities of the shoulder like flexion, extension, abduction, adduction, etc. That's something which I think is very, very necessary. Maintaining the right posture, and as bad posture, I think triggers tension in your shoulders besides back and neck. And this is something which is very, very common, especially in the younger people. I've seen these days of the bad posture.
Yes.
Minimizing stress, as it is very well established that stress causes and extenuates trauma, right?
Mm.
And finally, of course, the right diet, which is the most important to get a good balance of all nutrients for your body, shun sugar, saturated fats, high glycemic index food, minimize gluten and fat acids. Of course, I'm not an expert in that area, but I think this is common sense which tells me that,
Yeah.
this is what everybody should be looking at so that we are always in the preventive mode rather than getting into this and getting into the longer process of kind of coming out of it. What are your views, Dr. Desai?
Absolutely. I think I concur with all your points, especially in idiopathic, like I said, idiopathic frozen shoulders without any cause. There are some theories there's research which is happening in this area wherein it's been pointed out that weakness in the shoulder joint muscles around the shoulder joint, may lead to an idiopathic onset in the 40 to 60 age group for frozen shoulders. So, especially there, and of course, like we have already mentioned, that it's very important. You may be diabetic. It's very important for you to know that 20% of the diabetics often get frozen shoulders. So it's important to monitor and maintain good blood sugar levels and hormonal levels in the body, and so that is also extremely important.
Okay, now I have one final question before we kind
Sure.
of close this discussion. Of course, this discussion can go on at least for one full day, I feel, because there's so much to learn on this, and so much to know, and so much to kind of absorb. But my question is that what are the chances of recurrence once you feel kind of you're all right? And what's the prognosis of the frozen shoulder condition? Maybe you can answer it other way around, the prognosis and then the recurrence.
Process is actually good in frozen shoulder. It's about 80% recovery when reported in time, that is within 2 weeks of symptom onset. Prognosis is naturally better when the patient doesn't have any other comorbidities or any other health issue. Recurrence, yes, but it's always a possibility. For any condition, recurrence is a possibility. But if we can vouch for performing our maintenance programs, exercise training, and maintaining a good blood sugar level, this possibility keeps on shrinking. Also, one other thing I'd like to highlight over here is one of the things that even you mentioned during what causes the frozen shoulder was that when patients have trauma, and that's fracture or any other injury to the shoulder joint, they often wear a sling, right? And that sling immobilizes, so further immobilizes the joint. So there are the mystical part about frozen shoulder is this, if you ask me, that I have seen a lot of patients walk in with sling to me. Yeah. So you get what I'm saying? Patients have a frozen shoulder, but there is a myth that if your shoulder hurts, you need to put it in a sling. And such practices can increase your rate of recurrence. So one thing that one should absolutely avoid if they have a diagnosis of frozen shoulder is to wear a sling, right? Because you want to keep it as mobile as possible. But this is something that we need to keep in mind. Wearing constrictive garments constrictive, like suppose there is a cardiac surgery in the future, this patient will have a more rate of recurrence. Similarly, if the patient is wearing a sling, will have a more rate of recurrence. So this is something we can keep in mind.
So I would actually imagine a patient walking in like that and you telling him, please remove the sling. The first thing.
100%.
maybe in a better way.
Mostly patients come in and say, my arm is frozen and they are in the sling. And I say, that's the reason why your arm is frozen. Can you please remove that?
So with this, we come to the end of our discussion on frozen shoulder for today. Thank you, Dr. Desai, for a wonderful insight into frozen shoulder. Thank you all listeners, and we hope you find these insights very informative and very useful. Stay safe, you and your loved ones. Stay fit and stay healthy.
Right. Thanks, Gopal. This was really nice.